let's bring you this story. South Africa is most likely to see a fifth wave of COVID-19 infections as it heads towards winter. That's according to the Health Minister, Dr. Phaahla, who's given an update on COVID-19 in the country. Phaahla has also highlighted the increase in infections that's been seen in those below the age of 20. eNCA senior journalist Aviwe Mtila filed this report.
COVID-19 numbers and infections have been confusing in the last 2 weeks, according to Health Minister Phaahla.
The picture we have seen has been almost that we can call a stalemate, where there is no serious decline, and yet we can't say there's any worrying rise in infection.
The minister says epidemiologists have linked the plateau as well as more cases among younger people to the opening of schools.
In support of this is also the observation that in the last 14 days, we have actually witnessed more infections amongst the below 20 years of age, that is the school-going age. Some colleagues who are also in the GP practices have also reported similar observation of seeing more of school-going age below 19 years testing positive.
Phaahla says a clearer picture should emerge towards the end of February. However, he warns that a fifth wave is lurking.
It is expected that by the end of February, we should be able to reach 5% of positivity, as I've indicated that once the schools now are settled, movement is settled, movement of people, we expect the continuing of the downward trend. But there is also expectation that as we get closer to winter, we'll get closer to the fifth wave. That the fifth wave is likely to break as we get closer to winter. Of course, it may even come closer earlier, depending on whether we experience variants of concern much earlier than we did with the Omicron.
Meanwhile, Phaahla has appointed an appeal committee to adjudicate on the matter between the South African Health Products Regulatory Authority and an organization called Free the Children, Save the Nation. The organization is against vaccinating children between the ages of 12 and 17. Aviwe Mtila, Johannesburg.